In the midst of pandemic, our heart are devastated when we saw the effect of the typhoon and the natural disaster for our countrymen at sa mga kababayan po natin. Huwag po kayo malulungkot at laban lang po tayo dahil tayo mga Pilipino. Ngunit, lagi natin tandaan na may kaakibat na mga sakit ang dulot ng pagbaha. So, ngayong pong araw na ito ay ituturo ko po sa inyo o isi-share ko po sa inyo ang 5 common diseases or top diseases during typhoon season. So, samahan niyo po ako. Tara! Hello guys, this is Sir Mark Diacos and thank you for dropping by here on my channel. And sa mga bago lang po dito, ako nga po pala ay isang registered nurse and professional teachers from the Philippines. But right now, I am here in Kuwait practicing my nursing profession. So, happy 1,000 subscribers na po tayo at asahan niyo po, nagagawa pa rin po ako ng mga informative videos at mga pwede nyong matutunan at kung ano pang gusto nyong makita sa akin ay papakita ko lang po sa inyo. At kung mga gusto po kayong mga videos o video request ay comment down below lang po tayo. So maraming salamat po at ngayon po ay aalamin natin ang mga top diseases during typhoon season. Tara na! Flood is the most common natural disaster across the globe. That is why it becomes very important to protect your health during and post floods. According to World Health Organization, floods can potentially increase the transmission of the following communicable diseases. First, waterborne diseases. Second, vector-borne diseases. Those waterborne diseases includes typhoid fever, cholera, Leptospirosis, and Hepatitis A. On the other hand, vector-borne diseases may include malaria, dengue fever, and yellow fever. Subsequently, according to Department of Health, 5 common diseases during the rainy season includes dengue, leptospirosis, cholera, hepatitis A, and typhoid fever. Number 1, dengue fever. Dengue fever is an acute infectious disease caused by a bite of a Aedes aegypti day-biting mosquito which lay eggs in clear and stagnant water. Signs and symptoms of dengue includes sudden onset of high fever which may last to 2 to 7 days, joint and muscle pain, pain behind the eyes, weakness, skin rashes, nose bleeding when fevers start to subside, abdominal pain, vomiting of coffee-colored matter, dark-colored stool. Treatment for dengue. There is no known cure to dengue. The treatment depends on what symptoms the patient is manifesting. Once you notice the signs of dengue, immediately go to your doctor. Dengue patients are advised to drink lots of fluids to manage the disease. Healthy individuals aged 9 to 45 may take dengue vaccine to avoid the disease. How do I prevent it? First, cover water drums or pails at all times to prevent mosquitoes from breeding. Second, replace water in flower vases once a week. Third, clean all water containers once a week. Scrub the sides well to remove eggs of mosquito sticking to the sides. All tires used as a roof support should be punctured or cut to avoid accumulation of water. Collect and dispose all unusable tin cans, jars, bottle, and other items that can collect and hold waters. Number 2, leptospirosis. Leptospirosis is a disease that caused by the entry of certain bacteria which is Leptospira through wounds when it is contact with flood, waters, vegetation, and most soil contaminated by the urine of infected animals such as rats, has incubation period of 7 to 10 days. Signs and symptoms includes fever, non-specific symptoms of muscle pain and headache, calf muscle pain, reddish eyes for some cases. For severe cases, liver involvement, kidney failure, or brain involvement indicated by yellowish body discoloration, dark colored urine, and light stools, low urine output, and severe headache. Treatment for leptospirosis includes taking the antibiotics prescribed by a doctor. Consult your doctor early because early detection or recognition and treatment for leptospirosis will prevent complication from the disease. Do I prevent it? First, avoid swimming or wading in a potentially contaminated water. Second, use proper protection like boots and gloves when work requires exposure to contaminated water. 3. Drain potentially contaminated water when possible. And number 4, control rats in your household by using rat traps or rat poison. Keep your house clean. Number 3, cholera. Cholera is a disease caused by a certain bacteria called Vibrio cholerae, and it can be transmitted by eating food or drinking water with contamination of human waste. Signs and symptoms includes sudden onset of frequent and painless watery stools, vomiting, rapid dehydration like sunken eyeballs, and wrinkled and dry skin. Treatment for cholera includes the resolvement for dehydration such as giving a replacement for body fluids such as Orisol or oral rehydration solution or homemade solution composed of 1 teaspoon of salt, 4 teaspoons of sugar mixed with 1 liter of water. If diarrhea persists, go to nearest hospital. How do I prevent it? First, drink only safe water and clean water. If you unsure, boil drinking water upon reaching boiling point. Extend boiling for 2 or more minutes. Number 2, do water chlorination. Number 3, keep food away from insects and rats. Number 4, wash and cook food properly. Number 5, sanitary disposal of human waste. Number 6, use toilet properly and clean toilet every day. Number 7, wash hands with soap after using the toilet and before eating. Number 8, keep surroundings clean to prevent flies and other insects and rodents from breeding. Number 4, Hepatitis A is a disease caused by eating food contaminated with human waste and urine of persons who are sick with Hepatitis A. Signs and symptoms includes fever, flu-like symptoms like weakness, muscle and joint aches, loss of appetite, dizziness without or with vomiting, abdominal discomfort. Jaundice may follow after a few days. Treatment: no specific medicine to cure the patient or shorten the course of illness of infected patients must be isolated, advised to rest, take plenty of fluids and avoid fatty foods. Patients who are failed to take fluids or too weak to eat are sometimes admitted to hospitals for intravenous administration of fluids and vitamins. How do I prevent it? First, wash hands after using the toilet, before preparing foods, and before eating. Number 2, dispose human waste properly. Number 3, thoroughly cook oyster, clams, and other shellfish for 4 minutes or steam them for 1 minute and 30 seconds. Number 4, practice safe handling and storage of food and water. Number 5, the disease is self-limiting and may not last for 1 to 2 weeks. Patient often recovers without treatment. Number 5, typhoid fever. Disease is caused by a bacteria called Salmonella typhi, and it is transmitted by consuming food and water contaminated with human waste. Signs and symptoms are sustained high fever, headache, malaise or weakness, loss of appetite, diarrhea or constipation, and abdominal discomfort. The treatments are: take antibiotic duly prescribed by your doctor. Second, treatment varies depending on the symptoms of the patient. And number 3, get the vaccine to avoid getting the disease. Those are the top diseases during typhoon season. So sana po may natutunan po kayo sa aking video, and don't forget to like, share, and subscribe my channel. Thank you!